Thyroid disease are the most common ones. Thyroid disease can be divided into three major groups. There is excessive production of the thyroid hormone, which is called hyperthyroidism. There is decreased production of the thyroid hormone, which is called hypothyroidism. Multiple nodules or generalized swelling of the thyroid gland is called goitre. The thyroid gland is one of the largest endocrine glands. The thyroid gland is found in the neck below the thyroid cartilage. It has a butterfly shape. It controls how quickly the body uses energy, makes proteins, and controls how sensitive the body is to other hormones. These hormones regulate the growth and rate of functions of many other systems in the body. This gland also affects the rate of growth on the hair and bones, the body's weight, temperatures, and energy level, as well as the function of the heart and digestive system. Thyroid disease is a very common endocrine disorder, especially in women. Hypothyroidism, underactive thyroid, is a condition in which your thyroid gland doesn't produce enough of certain important hormones. Symptoms of hypothyroidism include feeling tired, feeling cold, heart problem, increase in weight, depressed feeling, hair loss, hoarse voice, and bowel problems. One of the common causes of hypothyroidism is Hashimoto's disease. In Hashimoto's disease, there is an immune response of the body against the thyroid gland, which causes decreased function of the thyroid. Hypothyroidism can result from treatment of hyperactive thyroid. Thyroid disorder can also be caused by change in the structure or form of the thyroid. Hyperthyroidism, overactive thyroid, is a condition in which your thyroid gland produces too much of the hormone thyroxine. Hyperthyroidism can accelerate your body's metabolism significantly. Symptoms of hyperthyroidism: feeling warm, shortness of breath, loss of strength, menstrual complaints, weight loss, rapid heartbeat, diarrhea, physiological symptoms like fear and irritability. These symptoms usually don't all occur at the same time. In some cases, the thyroid gland might also be enlarged. The most common cause of hyperthyroidism is Graves' disease. It is an autoimmune disease where your body produces antibodies to stimulate the thyroid gland, which produces excessive thyroid hormone, more than the requirement for normal functioning of the body. A doctor may diagnose thyroid disease by assessing a patient's symptoms, palpating the neck to check for changes in the thyroid gland, and blood testing to determine the body's levels of the circulating thyroid hormones. Goitre is one of the most common thyroid problems. When you have goitre, the thyroid gland gets enlarged, and there is visible swelling in the neck. Goitre has several causes such as infection, iodine deficiency, benign or malignant disease. A malignant disorder is extremely rare. When you have a goitre, there can be a problem in swallowing or breathing. Before treating goitre's, underlying causes must be determined. Thyroid problem can be diagnosed with blood tests and sometimes using thyroid scan or puncture. Other times, thyroid swelling disappears even without treatment. Hypothyroidism can be treated with thyroid hormone pills. Depending on the cause, hyperthyroidism can be treated with medication to reduce the production of thyroid hormone. Another option is treated with radioactive iodine to stop the function of thyroid cells. Surgery can also treat hyperthyroidism. Goitre can be treated with surgery or with radioactive iodine. Do you have any symptoms which might indicate thyroid problems? Please consult your general practitioner for advice. Standard treatment for hypothyroidism involves daily use of the synthetic thyroid hormone levothyroxine, such as levothyroid and synthroid. This oral medication restores adequate hormone levels, reversing the signs and symptoms of hypothyroidism. 1 to 2 weeks after starting treatment, you will notice that you are feeling less fatigued. Treatment with levothyroxine is usually lifelong, but because the dosage you need may change, your doctor is likely to check your TSH level every year. Untreated hypothyroidism can lead to a number of health problems. Constant stimulation of your thyroid to release more hormones may cause gland to become larger, a condition known as a goiter. Hypothyroidism may also be associated with an increased risk of heart disease, primarily because high LDL cholesterol, the bad cholesterol, can occur in people with underactive thyroid. Depression may occur early in hypothyroidism and may become more severe over time. Hypothyroidism can also cause slowed mental functioning. Long-term uncontrolled hypothyroidism can cause damage to your peripheral nerves. Signs and symptoms of peripheral neuropathy may include pain, numbness, muscle weakness, or loss of muscles. Low level of thyroid hormone can interfere with ovulation, which impairs fertility. Moving to treatments of hyperthyroidism. Several treatments exist. The best approach for you depends on your age, physical condition, and the severity of your disorder. Radioactive iodine taken by mouth. Radioactive iodine is absorbed by your thyroid gland, where it causes the gland to shrink and symptoms to subside, usually within 3 to 6 months. Because this treatment causes thyroid activity to slow considerably, causing the thyroid gland to be underactive, hypothyroidism, you may eventually need to take medication every day to replace thyroxine. Second, anti-thyroid medication. This medication gradually reduces symptoms of hyperthyroidism by preventing thyroid gland from producing excess amount of hormone. They include propyl thiouracils and methimazole. Symptoms usually begin to improve in 6 to 12 weeks, but treatment with anti-thyroid medication typically continues for at least 1 year or often longer. Third, beta blockers. These drugs are commonly used to treat high blood pressure. They won't reduce your thyroid level, but they can reduce a rapid heart rate and help prevent palpitation. For this reason, your doctor may prescribe them to help you feel better until your thyroid levels are closer to normal. If you cannot tolerate anti-thyroid drugs and don't want to or cannot have radioactive iodine therapy, you may be a candidate for thyroid surgery, although this is an option in only a few cases. Risks of this surgery include damage to your vocal cords and parathyroid glands. Thyroidectomy is an operation that involves the surgical removal of all or part of your thyroid gland. The steps of this operation include horizontal anterior neck incision, if possible within a skin crease, create upper and lower flaps between the platysma and strap muscles, divide the ventricular between the strap muscles and anterior jugular vein, separate the strap muscles from the thyroid glands, divide the middle thyroid vein, mobilize the superior pole of the thyroid loop, divide the superior thyroid artery and vein close to the thyroid gland, avoid injury to the external branch of the superior laryngeal nerve and the superior parathyroid gland, identify the recurrent laryngeal nerve whenever possible using the nerve monitoring device, identify the inferior parathyroid artery, divide the inferior thyroid artery and vein, separate the thyroid loop and isthmus from the trachea, repeat this process for the other thyroid loop, remove the thyroid gland, reapproximate the strap muscle, reapproximate the platysma muscle, clothe the skin with subcuticular stitch. Hyperthyroidism can lead to a number of complications. Some of the most serious complications of hyperthyroidism involve the heart. These include a rapid heart rate, a heart rhythm disorder called arterial fibrillation, and congestive heart failure, a condition in which your heart cannot circulate enough blood to meet your body's need. Untreated hyperthyroidism can also lead to weak, brittle bone, osteoporosis. The strength of your bones depends in part on the amount of calcium and other minerals they contain. Too much thyroid hormone interferes with your body's ability to incorporate calcium into your bones. People with grave ophthalmopathy develop eye problems, include blogging, red or swollen eyes, sensitivity to light, blurring or double vision. Untreated severe eye problems can lead to vision loss. Hyperthyroidism also places you at risk of thyrotoxic a sudden intensification of your symptoms leading to a fever, a rapid pulse, and even delirium. If this occurs, seek immediate medical care.